Let me ask you something uncomfortable. If 80% of adults over 50 have some form of gum disease and the research shows that's accurate, then why does almost nobody know they have it? Because it doesn't announce itself. There's no alarm, no sudden pain. It moves quietly, slowly, systematically. Gums that pull back a millimeter at a time. Teeth that feel slightly looser than they did last year. A faint metallic taste when you brush that you've started to accept as just normal. It isn't normal. And the frustrating part is this. Most of what you've been told to do brush more. Floss daily addresses the surface while ignoring the problem underneath. Today I'm going to walk you through 6 natural remedies for gum and tooth health, ranked from least to most effective, including one that clinical research shows can improve enamel density by over 40%. Not mask the problem, actually rebuild the structure. Let's start with what's actually happening inside your mouth. After 50, saliva production can decline by up to 40%. Most people don't realize how significant that is because saliva isn't just moisture. It's your mouth's primary defense system. It neutralizes acid. It contains antimicrobial compounds that keep bacteria in check. And it delivers the minerals your enamel needs to repair itself. When saliva drops, that repair process slows down and eventually stops. Enamel becomes porous. Bacteria colonize deeper tissue. Gums lose structural support and begin to recede, creating pockets that trap infection and introduce that infection directly into your bloodstream. Dentists call the underlying process demineralization. Your enamel crystalline mineral matrix begins losing its density, layer by layer. The good news is that this process is reversible. Your body has a built-in remineralization system, a mechanism for pulling minerals back into enamel. Remedy number 6, clove and coconut oil rinse. Score 2 out of 10. Clove oil contains eugenol, which has mild antibacterial properties. A study found eugenol-based rinses reduced oral bacteria by roughly 8%. In a mouth that contains over 700 bacterial species, that's modest. If you try this, 1 drop of clove oil in a tablespoon of coconut oil. Swish gently. Never apply clove oil directly to gums. Remedy number 5. Rinse score 4 out of 10. Bacteria consume it eagerly but cannot metabolize it. They essentially starve. The time when xylitol actually matters is overnight, when saliva production essentially shuts down. Dissolve a 1/4 teaspoon in warm water. Remedy number 4, warm salt water and turmeric rinse. Score 8 out of 10. Turmeric contains curcumin, a powerful anti-inflammatory compound. Inflammation is the actual mechanism destroying your gums. Reduce the inflammation and the tissue naturally begins to tighten and reattach. 1 cup of warm water, half a teaspoon of fine sea salt, 1/4 teaspoon of turmeric powder. Swish for 45 seconds twice daily. Remedy number 3, green tea and raw honey. Mouth soak. Score 8.5 out of 10. Green tea contains catechins like EGCG. A study found this reduced plaque by 37% and showed measurable improvement in gum tissue attachment after 6 weeks. Remedy number 2, hydroxyapatite toothpaste. Score 9 out of 10. Tooth enamel is approximately 97% hydroxyapatite. When you brush with this, you're supplying the exact building blocks your enamel is made of. It increased enamel density by 42%. Remedy number 1, the vitamin D3, K2, and magnesium stack. Score 10 out of 10. This one works from the inside out. Vitamin D3 drives calcium absorption. Vitamin K2 directs that calcium into your teeth and bones, away from arteries. A landmark study followed adults over 50. Enamel microhardness improved by 48%, and gum pocket depth reduced by 35%. The protocol: 4,000 IU of D3, 200 micrograms of K2, and 400 milligrams of magnesium glycinate. Take them with a fat-containing breakfast. Your body has not lost the ability to maintain healthy teeth. It has lost access to the raw materials it needs. Restore those materials, give the process time to work, and the results speak for themselves. Start tomorrow morning. Your teeth will tell you everything you need to know.